Hey everybody, welcome back to my channel. It's September and that means that it is Thyroid Cancer Awareness Month. Thank you so much for joining. I hope that you have done a neck check this month and hopefully if you have found something that you have contacted your doctor. And I just wanted to give an update about where I've been the past 9 months. This is my 9-month surgery update video as well. Yesterday, I went to the surgeon, and it was just a follow-up. I think I have to see him 1 or 2 more times, but it was just a follow-up appointment since my surgery, just to check how things were going. He said things feel good. He said that things look good. The last time that I was in there, he stuck a scope down my nose, checked my vocal cords. Those all looked good. The biggest concern for me with my vocal cords is that I still can't sing. And if you don't normally sing, I mean, singing in the car and singing in the shower does not count. That's not what I'm talking about. I'm talking about singing. That is really hard. I can't really do it. I have a small scale. I'm a low alto now, which is not where I was. I was a high soprano. So it's a little bit difficult for me. I'm noticing that there are some easier notes for me now than there was, but it's still difficult. And he had mentioned to me that in April or May, if my voice is still not better, that he will send me to a voice specialist at Wake Forest, and they will do analyzing of my voice, see what they think they can help me with, or if they think that there's nothing they can do. So I'm really excited about going to see somebody to see if they can help me. Hopefully I can progress, and by the time April comes, I'll be better, but maybe they'll still be able to help me. But he said everything looks good. I don't go back to see him for another year, so that's why he said in April for me to call him if things have not changed. He said that, you know, my scar looks good, everything looks good. He was just explaining to me again about why my voice is so irritated. My thyroid was big. It was wrapped around my vocal nerves. Not the actual voice box, but the nerves that connect the voice box. There's nerves that go down here, and those are connected to your voice box. So those are the ones that were being squeezed by my thyroid. And so he had a difficult time getting them loose. And so the things that are in my neck are just aggravated. And it takes time for swelling to go down, scar tissue's there. I can feel that something's different. When I talk, my voice gets tired, I get out of breath, and it's like a strain. There's a strain in my neck right here, and it's uncomfortable. It doesn't hurt, but I know when I need to slow down and take a breather. So I try to be careful with my voice, because my voice is important to me, and I don't want to lose it completely. So I have to be careful. And then 2 weeks ago, I went to get my ultrasound results. I had my first ultrasound since my surgery, and the actual ultrasound, the procedure, was more painful than I expected, which I didn't expect it to hurt at all, because my thyroid's gone. Even going around the scar didn't hurt, but there's this one little area right here, and I could see that she was measuring something on the screen. Because when you're having your thyroid ultrasound, you're laying back and your head's turned, and you can kind of, you know, cut your eyes back to the screen. So I could see that she was measuring something, and she was also checking the blood flow. So I was a little nervous about getting my results, but the endocrinologist said that the pain that I have been having in my neck and what she had measured was an enlarged lymph node. And normally that is kind of like a red flag after you've had thyroid cancer, but because my thyroid globulin was undetectable, that means that it's not cancer. She is going to keep watching it just to see if anything changes. But for now, it's good news. Since the thyroid globulin is undetectable. And if you aren't sure what thyroid globulin is, it's the cancer marker for thyroid cancer. After you have your thyroid out, the only thing that can produce thyroid globulin is thyroid cells. And if you have thyroid cells left in your body, then they're going to produce a thyroid globulin, which means that you could possibly have thyroid cancer again. And that's why they want your thyroid globulin to be undetectable. So mine was, so that's good news. The other issues that I'm having with my neck is, other than the pain right here, I just have a, you know, the just uncomfortable kind of full feeling right in my neck, kind of around my scar. That's just probably scar tissue, with the way that the doctor was digging around in my neck. Things are swollen, and it's just normal. It's going to take time. You know, my surgery was in December 18th, and it's at the end of September now. So, it's still a little early, for things to have already calmed down. They're getting there, but it's still a little bit early. So hopefully, in the next 6 months, I'll be further out than I am now, which is not bad. The only other thing that is a little frustrating is turning my head. It kind of pulls right in here when I turn my head that way, and then it pulls right in here when I turn my head that way. So if somebody's talking to me and they're behind me, I'd like for them to come stand in front of me, because it's just uncomfortable to leave my head turned back around for so long. So I try to make sure that if someone is behind me and they want to talk to me, that they know. I mean, most people know, but, you know, sometimes they just forget. So I just, you know, if they could just come stand in front of me, it's a whole lot easier for me to talk to people. It's harder for me to just turn my head and leave my head there, you know. So that's really the only other thing that's really kind of frustrating. I have come a long way. As you can tell, my speaking voice is really good. It still gets tired at the end of the day, so I try to rest it. I get out of breath. My weight's doing good, and that just means that my doctor is suppressing my thyroid, my TSH. She wants to keep it low so that my body doesn't think that that I have a thyroid, and hopefully that will keep the thyroid cells that are any that were missed by treatment. Hopefully they won't grow back. So that's what the purpose of keeping me hyper is for. Other than that, you know, it's just one day at a time. There's days where I'm just really tired. And you know, that's hard. I have to make sure that I take my medicine every day. I can't skip a pill. It's really important, that I make sure that I take it at the same time every day, on an empty stomach, so that it can absorb the way that it needs to. But other than that, I think things are pretty good. I'm very fortunate that my cancer was caught early, and that I was able to have treatment. And yeah, so things are good. You know, just one day at a time. That's all I can do. And hopefully I will continue to get better, and hopefully my cancer won't come back. So again, it is September, and it's Thyroid Cancer Month. So please make sure that you have done a neck check. You can do one at home. They are really easy. Take a glass of water, take a mirror, take a sip of your water, lean up, take a swallow, look in the mirror, and if you see anything in your neck, please go to your doctor. It's really important to have your thyroid checked, and to keep check on that, so that you can stay healthy and, you know, catch anything that might come up. So thank you for watching, and don't forget to subscribe.